Well, I'm Carla Lynch. I'm an assistant professor of nursing in the Oxley College of Health Sciences School of Nursing here at the University of Tulsa. And I work in primarily the baccalaureate program, where we take nurses, or we make nurses from people right out of high school. They come into our program and start in their prerequisite courses and quickly progress into their nursing courses. And we as faculty get to be instrumental in helping them kind of achieve their pathway through various clinical experiences in hospitals. We have connections to really all the big three hospitals here in the Tulsa area, as well as multiple community clinics, mobile clinics, schools, just a wide variety of psychiatric areas. And so they really get a very well-rounded experience in clinical settings. And we arrange all of those for them. And then as they've experienced a few clinical kind of excursions and outings right there with us with them, then they get to the point where they're coming up on their senior year and they can do a clinical externship with a hospital in the Tulsa area. And those are actually paid externships. But to get those, it's really important that they've had that exposure. And so since we have good connections with them, we'll write them letters of recommendation, because that's really key to getting those high interest areas like OB, labor and delivery, pediatrics, oncology sometimes, even like emergency departments. And the students really want to be in those exciting areas for those externships to make sure it's what they want to do when they graduate. So we'll write letters of references and make sure that they're introduced to those areas. And we have a very high rate of acceptance into the externship programs. And so when they've completed those between their junior and senior year, they really come into that senior year with a high level of confidence and are ready to face that leadership rotation that they do at the end, which is rather unique to TU as well, that they get a lot of leadership experience. And then when they graduate in kind of April, May, we start to write letters of reference for those RN positions then. And those are often sort of fed from those externship experiences that they've had, that they've already had exposure to the nurse managers, they've met staff on the floor, and they're well acquainted with really the processes on that unit. So it's a very easy transition into an RN role then. And we're happy to help them get those positions through recommendations.